Hi, I'm Dr. Parijat Kumar, Director of International Sports and Orthopedic Manual Therapy. Welcome to our today's Pelvis Virtual Lab Treatment and Assessment Quiz. So yes, we have included the assessment part here as well. So we would be asking some questions regarding the assessment as well, but mostly the treatment. So I hope you enjoyed our today's lab or the webinar. So best of luck, guys. I am sure all of you scored good marks and secured your certificate. So here we go for the questions and the answers for Pelvis Treatment Lab iSolved. So first question was, the patient presented with L on L dysfunction. So which side will have the positive sitting flexion test? The correct answer of this is right side. Yes. So when the person's sacrum torsion is on the left side, so if the torsion is on the left, that means it's going on to the left. So the sitting flexion test would be actually positive on the right side. That's the correct answer. Second question, it's a case study question. The patient is a 29-year-old female with a left pelvic postpartum pain. The left sacral base is deep. The sitting flexion test is positive on the left. The supine to long sitting test is long to short on the left. Yes, long to short. So what is the dysfunction over here? This is one of the very common dysfunction, guys. This is right on right, which is the second option. So right on right is the correct answer for this question. The third question was, supine to long sitting position is performed and the position of the right leg changed from short to short. So when you're doing the supine to sit test, one of the leg is going actually short to short. So the possible dysfunction at the right side is they are all except. So I hope you read the question correctly. We are talking about except. We are not talking about which is the right answer for short to short. The following options are all the right options except. So in flare, true shortening, up slip, out flare. When there's a short to short thing in the long to sit test, actually all the options are right except the fourth option, which is the out flare. You can have in flare, you can have true shortening, you can have up slip, but when the person is having short to short on the supine to sit test, you cannot have an out flare. Alright, so the correct answer is out flare. Next question, the patient is a 33-year-old female, showed left pelvic pain. There are findings of left sacral base being deep, inferior lateral angle being left on the prominent, supine to long sitting is long to long, so which is like different from the other question. So the dysfunction is very simple. So if your sacrum, the base is deep and the ila is prominent, so this is very much the sacral flexion. So the correct answer is the left unilateral sacral flexion. That's the third option. Yes. What is the following dysfunction that you are going to treat first? We didn't really discuss about these dysfunctions, but you are going to actually treat these dysfunctions first before you really start treating the pelvic upslips and the sacral innominate or even the lumbar spine. So the correct answer to this is actually pubic symphysis dysfunction. So the pubic symphysis dysfunction in the center, you actually treat that thing first. That's what the research says. The next question, again a case study question. The patient is a 18-year-old wrestler with acute back pain and presented with the findings of sacral base being deep on the left side, sitting flexion positive on the right, and that's it. That's the only finding. I understand it's a very less findings, but try to guess the dysfunction. And yes, the dysfunction is actually the opposite torsion of the sacrum, which is the right on left. So when you know these findings are common, guys, I understand these torsions are difficult to kind of a name, but you need to know the findings that which sacral base is deep, which is ila. So this will come with the practice. So here the correct answer is right on left. All right. Okay, coming to the next question. This is an easy one. Which sling of the sacroiliac joint force closure, the muscle support, is targeted with the total gym squats with the latissimus pull downs? So there was a exercise with the total gym squats, or you can do like a standing and the lats pull downs with a TheraBand. So what sling of the force closure are you really tackling? The correct answer is very simple. It's posterior, the fourth option. All right. The next question, which dysfunction is targeted or treated with the doorway hip extension exercises? So we showed an exercise in our lab today, the doorway hip extension exercise, where we stabilize the back and the lumbar spine and we extend the hip. Now again, we didn't really discuss too much on the extension rotation syndrome at the lumbar spine. So excuse me, yes, these are the areas, these are the rotational syndrome where we have to do the hip extension exercise to correct the dysfunction. All right. The next question was, what is the position of hip? And I like these kind of a manipulation because I do a lot of manipulation. So these are like my favorite questions. What is the position of the hip or the lower extremity in the forward torsion manipulation for correcting L on L sacral torsion? So when you have the L on L sacral torsion, so an easy way to do is the right hip internal rotation manipulation. So you internally rotate the right hip and then manipulate. So the correct answer is the hip internal rotation. The next question, in order to perform the muscle energy technique to correct the unilateral sacral extension, positional fault, the same side of the hip should be kept in what position? So you need to know all these positions in order to do those muscle energy techniques. The correct answer is hip abduction or abduction and external rotation. Why? Because that gaps the sacroiliac joint and helps to move the sacrum into further flexion. So the sacrum is stuck in extension. So when you move the hip into abduction and external rotation, it helps to gap the sacroiliac joint and help it to move into the sacral flexion, because your sacrum is stuck here. You push it down so that the hip will help you to push it down into the flexion. All right. Next question, an anatomical question. Which sacroiliac ligaments prevents the counter nutation? So this is the nutation, this is the counter nutation. The correct answer is a simple one, long dorsal ligament. We discussed this last time. Long dorsal ligament is the correct answer to this question, sir. What is the direction of force of scaffold lunate manipulation? This is one of our bonus questions. So what is the direction of force of scaffold lunate manipulation? So we were talking about the wrist in few labs before. So our scaphoid lunate joint stuck here is located here, and I can actually treat tennis elbow by manipulating my scaphoid lunate joint, where I can actually manipulate the scaphoid lunate in the palmar direction, like this, palmar direction, and it will help with the extension and also to relieve the tennis elbow thing. So the correct answer is the palmar direction is the manipulation side. All right. So guys, that was it for all the questions. There were 12 questions. I hope you secured 7 out of 12 or more to secure your certificate. I hope you learned from today's lab. I would be doing personally, our next lab would be on the shoulder, and that's why I've written that I don't really believe on these general terms called frozen shoulder or arthritis. You have to find out the real root cause, and in our next lab we would be discussing about the shoulder, the various things of shoulder, the movement impairment of the shoulder, the diagnosis, the impingement, and the various positional faults of the shoulder as well. That's why you are having those rotator cuff and impingement things. So our next lab would be on the shoulder and its relationship with the neck, thoracic, ribs, which is the regional interdependence. So please guys, register for our next lab, which will be the shoulder. You have any question, concerns, you can email us at isorehab@gmail.com. Any concerns and questions, please you can fill it in the comment section, and you can subscribe to our YouTube channel and follow us on Facebook, Instagram, Twitter and LinkedIn. I hope to see you soon in our next lab. Keep learning and improving lives. This is Dr. Parijat Kumar from International Sports and Orthopedic Manual Therapy. Thank you. Cheers.